Welcome back. A healthy mouth is key to overall health, but how much do you really know about taking care of your teeth? We've got Dr. Bryan Dunlap here from Dunlap Dental joining us for a short true or false quiz about your oral health. I really like these questions. I think a lot of people need to know about it. First one is, some bleeding of the gums after you brush or floss is normal.
That would be false. If you have any bleeding of the gums, that is a sign of a problem. The most common problem would be gingivitis, when your gums are a little red and swollen, and that's the most mild of gum infections you'll have. But any bleeding when you brush and floss is usually a sign of an issue, so you need to step up the brushing and flossing and see your dentist, obviously.
All right, and if your teeth are sensitive, it's a sign of decay? True or false?
That one's kind of a true-false thing.
Yep.
That's both. Well, you know, it can be a sign of decay. Sensitivity also, sometimes people will have sensitive roots from a little bit of gum recession, root exposure, but obviously sensitive to sugar and sensitive to colds, oftentimes a sign there may be decay. So again, you might want to get it checked out.
And here's what I'm curious about too, chewing gum. I mean, you've got different kinds of gum out there. Some says it's good for your teeth, but is it healthy? You
know, for a lot of years you always hear the dentist that doesn't seem to be a big fan of gum. I am actually, sugarless gum. Let's obviously stress that. Sugarless gum, I love it. I think sugarless gum, and there's new studies coming out all the time, folks, that talk about how sugarless gum helps, especially after meals, just clean particles out of your teeth. It stimulates saliva flow, which helps prevent problems, prevent decay. So I absolutely support chewing gum as long as it's sugarless.
I'm happy you're saying that because I love gum.
All right. No problem with that.
Well, dry mouth is a normal sign of aging. True or false on that one?
Okay, that is false. Now, you will see a lot of dry mouth, especially in older folks, and the main reason probably for dry mouth I've seen is a side effect of medications. A lot of high blood pressure medications will cause dry mouth, and dry mouth can be a big problem. Also, we see it with people maybe going through chemotherapy or other problems. Be aware, if you all of a sudden start to notice you are developing dry mouth, consult your dentist, because it can really cause a lot of decay problems. We have immune properties in our saliva that actually prevent decay, and when you don't have a lot of your saliva, I'll see people that come in who had been healthy and all of a sudden have 4 or 5 cavities out of nowhere, and then it turns out they've had a lot of dry mouth problems.
Okay.
So pay attention to that. All
right. Well, how about this one? Flossing just a couple of times per week still keeps teeth healthy. True or false?
Well, it's better than no flossing at all. That is true, but false, we'd like you to floss every single day. I know a lot of folks have never heard that from your dentist out there, but no, I joke, of course, but seriously, floss every single day. We always have a joke, floss the ones you want to keep.
Floss the ones you want to keep.
Floss the teeth you want to keep. That's a good rule to live by.
Definitely is. All right, and this last one here, pregnant women require extra dental health protection. True or false?
That is true. You will see if women, when you're pregnant, you will notice that your gums bleed a lot easier. That is a common problem with pregnancy gums, we call them. But yeah, if for some reason, I think it's the hormone changes and other things, we have issues with pregnant women and their gums and their teeth. So pay extra attention and make sure you go see your dentist for a checkup while you're pregnant.
All right, Dr. Dunlap, thanks so much for joining us and for all the great information.